Kingston. I want to dance with somebody. Perfect choice. What's yours? 81333 is the way to let me know by text.
The Sound.
The sound of Surrey. Together we can make a difference. BBC Radio Surrey.
Now it's 7 minutes past 7. There are just under 7 weeks remaining before all lockdown restrictions are due to be removed.
Step 4 will begin no earlier than the 21st of June. With appropriate mitigations, we will aim to remove all legal limits on social contact, and on weddings and other life events, we will reopen everything up to and including nightclubs and enable large events such as theatre performances above the limits of Step 3.
Provided the number of COVID cases continue dropping, the Prime Minister's announcement back in February still applies. But what about measures to contain future outbreaks of COVID or perhaps other viruses? Are lockdown, social distancing and face masks the answer for everyone? Or should measures be specifically targeted at-risk groups? And should we open up earlier than June the 21st? That's the question they're asking on the front of the Daily Mail this morning. Well, Dr. Chao Wang, a doctor from Kingston University, is one of several scientists who have signed a letter recently calling for a different approach. I asked him why.
I think there was very little benefit of continuing lockdown beyond 21st of June, according to the data, according to the modeling work.
Is it more that you want to see a quicker easing of the lockdown restrictions as opposed to say, right, getting rid of all the masks now, we no longer need to wear them?
If we truly follow data, not the days, I think we can afford to accelerate our opening the country a couple of weeks before the date.
Before the 21st of June.
21st of June. But I understand there was maybe pressures and other concerns. So that's why in the open letter, we urge the government not to further delay the timetable.
Right. And we're seeing, the front pages covered with what's happening in India and also in Brazil in terms of the spread of the virus and the impact there. Given that we don't know what will happen in a few weeks' time, do you not think that the health authorities should change their minds if we do see the situation get worse again?
You mentioned India, which is in a very bad situation. I think what difference between the UK and India is we have very high vaccination coverage. So just as I mentioned, by Office of National Statistics, 7 in 10 adults have already had antibodies by early April. And over 50% of all people in the UK or England have received vaccines. So I think this is a great success of our vaccine program. So if you look at, for example, Israel, some states in the United States, they have been largely back to normal without any surge in cases. So I think this is a really encouraging sign that the vaccine really works. And because of a very successful vaccine program, we can open as Prime Minister planned.
And what do you make of the reaction to your letter so far? What sort of response have you had?
I did receive some mixed reactions.
Saying what sort of thing? What were they? Talk me through the kind of responses.
Yeah, some were very supportive, saying that this is what we should have done, and actually we should have because in the letter we just said we should open no later than 21st of June, and some people actually says we should have a couple of weeks earlier than this date. Meanwhile, there are other group of people saying that we should be more careful because of someone mentioned India as well, saying that there may be unforeseen problem ahead, so we should be more careful. So I've got mixed reactions.
And I'm just going to read you something here from The Independent. They say a senior scientific advisor to the government told them if the letter had been written by anybody without professor in the title, it would have just been ignored. What do you make of that?
I think, myself is not a professor, but there are very great professors in the group of people who signed this letter, and I admire some of them greatly. And I think it's not really about the job titles, whether you're a professor or something else. I think it's about evidence. I think what we lacked during this pandemic is evidence-based medicine. So we should have always look at the evidence to say, okay, this intervention might be effective or not, instead of based on, okay, because this person is a professor, so we have to blindly listening to them. So
Right.
I think this is most important, looking at the evidence, looking at the data.
And do you kind of understand, like when we speak to people every day, there is some reticence to the idea of the ending of the restrictions and the distancing and all of that. It just seems almost we've worked so hard to keep this at bay and to all behave in a way that we're being told we have to. And then on the 21st of June to suddenly throw off the masks and, have a great big street party and all the rest of it. You can understand why people are a bit scared of doing that, perhaps.
Yes. I can totally understand. If you look at the data, there have been consistent higher than expected number of deaths at home. So one reason I speculated was because people were too scared to seek a treatment at the hospital or go to their GPs. So I think it's really important. Despite all cause deaths has been below 5-year average, I think this fear is very negative, have a negative impact on our physical health as well as mental health. So I think it will have a higher cost than actually the benefit. I think it's important that we not to scare people,
Yes.
encouraging them to, if you are not feeling well, do speak to your GP, go to hospital, seeking treatments.
Well, that's Dr. Chao Wang, a doctor from Kingston University. And it's an interesting one, isn't it? And on the front of the Daily Express, jabs help drive down the death toll to the lowest in 8 months. The Eye, green light for England to unlock on the 17th of May. And the Mail today, pretty much in tandem with what Dr. Chao Wang was saying there. The Mail says just one COVID death in latest daily figures, 50 million jabs given and cases at an 8-month low, with curbs set to last until mid-June. The Daily Mail asks, why wait 7 more weeks? Calls for a quicker end to lockdown grew yesterday as the daily COVID death toll fell to just 1. And I'd love to know your thoughts. It was interesting listening to Dr. Wang there, everything he was saying in terms of following the data and not the dates. And, the data's all looking very good. But the prospect, like I said, of taking off your masks and restrictions ending on the 21st of June, it makes me feel a bit breathless, and I don't know. How does it make you feel? Get in touch with me this morning. 81333 is how to do that. You can text the word radio, then send me your message about anything we are talking about this morning. You can always give me a call, of course.